Psoriasis is an immune-mediated disease which increases inflammatory molecules in the layers of the skin. The consequence of this could be a scaly plaque forming on the top layer of skin. Psoriasis can appear as three main types: plaque psoriasis, paradoxical psoriasis, and pustular psoriasis. Although some might think psoriasis is purely cosmetic, there are correlations to psoriasis being much more, and it can possibly cause other diseases as well. With psoriasis, there is an increased chance of myocardial infarction, increased liver inflammation, and a risk of fatty liver disease. 25% of patients develop some form of arthritis 10 to 15 years later, and there is an increased chance of stroke and type 2 diabetes. These are very serious diseases that are correlated to psoriasis. It all starts with a stress keratinocyte. The cause of the stress is unknown, however, it is due to some sort of antigen. An antigen is a foreign substance that the cell can then use to induce an immune response. The stress keratinocyte then presents the antigen to an antigen-presenting cell. In this case, it is a dendritic cell. The main role of dendritic cells is to present their antigen to a naive T cell to undergo activation. From here, the cell has two options, depending on which interleukin is presented. Th1 cells are a subcategory of T helper cells that are made when interleukin 12 is presented to the cell along with the antigen from the dendritic cell. Interleukin is a cytokine, which is a signal that the cell uses to communicate a certain action. The cell from here activates macrophages to become more aggressive using cytokines like TNF-alpha, interleukin 2, IFN gamma, and interleukin 18. Macrophages are the white blood cells of the innate immune system that are present and equipped to handle general threats. Th17 cells are found in psoriatic skin. They are produced when the antigen is also presented along with interleukin 23. Th17 cells are responsible for activating neutrophils to go to the site of the original stressed keratinocyte. Additionally, Th17 begins to produce inflammatory cytokines, which is what leads to the buildup of psoriatic plaque. Th1 cells produce TNF-alpha and interferon gamma. Th17 cells produce cytokines like interleukin 17F, interleukin 17A, and interleukin 22. These activate keratinocytes to then secrete antimicrobial peptides and chemokines like CXCL8 that call macrophages and other innate immune system cells over to the area. Now, these keratinocytes are stressed and begin to present antigens again to dendritic cells, which creates an endless cycle of immune response. Treatments for psoriasis can slow plaque formations but not entirely remove the disease. Some treatments are interleukin 17 inhibitors and TNF-alpha inhibitors as well. These prevent the stress response of keratinocytes and stop the formation of plaque from the Th1 and Th17 cells. Now remember, you are always welcome to do your own research on the topic. Like most diseases, the best way to avoid developing any severe health issues is by staying active. Continuing to exercise daily can have extremely positive effects on the health of everyone, especially patients with psoriasis. Take care.